this position, you can put it on a hospital bed, your home bed, actually anything that you can get as a stable surface, even a box jump, table, whatever. And really getting into turning any surface into an upper body ergometer, right? From a chair. Especially we have people who can't even get out of their chair, right? But if we can simply move them to the side of a table or a surface, this allows them to get an amazing upper body workout. And even if they've had, shoulder surgery, talk to me a little bit about what you think of this position.
Well, the thing I like about a sitting position that's not maybe up against a wall is that the person has to support their motion with the stability of their trunk. And so that's really an exciting piece, because now you're getting not only the shoulder exercise, but the trunk exercise, or the stability of the trunk exercise. And that's ups the game, if you will. With regards to shoulder rehabilitation, a person who's had a shoulder procedure is obviously ambulatory, so they can walk around fairly easily, position themselves fairly easily. Then they can use this type of device to get some early shoulder range of motion, or they can use it as, in a sense, an active assistive range of motion device. And you can see that as you're pedaling along, your shoulder is under 90 degrees of flexion, which is really quite nice for the, we'd say, the early post-surgical shoulder. So, most people should be able to do this, depending on the procedure and how far they are and complexity of the procedure, but many people should be able to do this exercise without putting themselves at risk.
First setup here, I'm sitting in a chair. My feet are firmly planted on the floor right in front of me. We've stuck a pillow behind my back just for support. Some chairs, might not need that, and it really is based on comfort.
Right.
But like you said, engaging the core, sitting up straight, looking ahead. And I've placed the keeper on the surface just to protect it.
Yeah.
If you were in a bed, probably just stick it right on the bed.
Yeah.
Same with a hospital bed or a home bed, but you can also do this like at a kitchen table, sitting here, just sitting down and sticking the foot here on the table just for stability. So resistance ranges, it's adjustable on the fly, both directions.
Right.
And what we like people to do is start out super easy. I mean, especially if they're post-op. But what we find too is people are so not used to using these fine muscles that they have in upper body. So we always like them to start really easy and then work up to it. I think a lot of times people are just like want to, turn it really high and hammer on it. So maybe you can talk a little bit about the importance of starting easy before, getting too aggressive on the resistance levels.
Yes. Well, the thing I particularly like about this equipment is that you can make it very easy. And really, when we start out, anybody with endurance ergometry, we start them out at lighter resistance and develop time. And then once certain time thresholds are hit, then you can start to backfill with resistance. So in the cycling, we work a lot with cyclists. That's a critical thing, is that you have to develop your spin endurance first before you start layering in resistance. A lot of times people try to go too much resistance too early, and that oftentimes leads to overuse type injury. And that's what you would most likely see here. It's far more important to develop that lesser resistance endurance first before you start to build your strength resistance. So really, when we start people out in clinical use of upper body ergometry, we really are minimally resisted. We just have them develop, work up to 5 minutes of just doing forward and back motion first, and then once you can do the 5 minutes and you feel reasonable with it, then you can get them, you can add in some resistance. There's a forward and back, as you were showing there, that's active assistive range of motion for maybe a really hurtful shoulder or for frozen shoulder or for post-surgical shoulder. But we can also, when I say forward and back, it's pedaling forwards and then pedaling fully backwards, so alternating the directions.
One thing that I've seen is what people do too is grab here firmly, right, and hold it.
Yeah.
And if you can only do one. So we're engaging here.
Yeah, absolutely.
Pushing in.
Yeah.
And then slow here.
That's that rhythmic stabilization that people have been trained to use through PNF type techniques is that stabilization, push-pull in an isometric fashion. So it's a way of being creative with regards to how you might exercise a person. And so absolutely, that's a very creative way of creating that exercise moment.
For setup, so we have 4 adjustable heights. And what we've done here is, if I make this up, right, it's going to push here flat.
Yeah.
So you can adjust this to any height, and it all depends on the height of the surface.
That's right.
So you just move this.
Yeah.
To where you need it. If it's higher, we can put it here. If it's lower here, but using the pin to find, what works for you, what level, snapping it in, and then making sure that we keep this even, or below the shoulder.